First, coming to equipments, there are two main equipments needed for measuring BP. First one, a quality stethoscope, and second, a BP measuring instrument. There are three main varieties of BP measuring instruments. First one is aneroid. This is how aneroid looks like. There is a pointer. This is used to mark the measurement of BP. Second is this mercury column sphygmomanometer. It has mercury in it and the level of mercury determines the BP. And lastly, we have automated device with manual inflate, which is also called as digital sphygmomanometer. Next step is how to prepare the patient. The patient should be made to relax at least for 5 minutes before the recording, and any excess clothing that may interfere with BP cuff should be removed for accurate recording. In this case, the patient has very thin sleeve, so no need of removing it. The patient should sit upright with their upper arm positioned at the level of heart. If the patient is so weak and he is not able to sit, then he can lie on the bed and the BP apparatus is to be kept just beside him, that is at the level of his heart. Nothing is so peculiar about which hand to choose while measuring BP. Most of them prefer left hand because it is a little bit thinner than the right hand and the pulse can be heard loudly. Turn off the fans or any devices which are noisy so that you can hear the recording clearly. On the BP apparatus and join the apparatus with the cuff and see there is no air in the cuff. Coming to the preparation of the stent, you have to on the stent before starting the procedure. Tap on the diaphragm. If you hear the sound prominently, then it is on. If not, then you can actually twist it like this, and now it is on and you can hear the sound clearly. So you have to make sure the stent is on or not by tapping on it. Okay, let's get started. Wrap the cuff around the patient's arm. It should not be very tight nor it should be very loose. The placement should be in such a way that these tubes are placed a little bit lateral to the cubital fossa. This is the cubital fossa and the tubes are placed slightly lateral to it. The reason behind that is that you can place your stent easily on the cubital fossa while recording the blood pressure. Now take the bulb in the hand which you normally use. If you are a right-handed person, hold it in the right, and if you are a left-handed, hold it in the left, so that you can easily press the bulb. After holding, turn the lock beside the bulb till it becomes tight so that no air escapes from it. Now place the stent right on the cubital fossa and start pressing the bulb. You will see the mercury column rising in the sphygmomanometer. Go on pressing the bulb till it reaches 180, in some instances till it reaches 200, and then slowly loosen the lock beside the bulb. Keep an eye on the mercury column. As you see, the mercury column goes down slowly, and at a certain point we started hearing the heart sound, and the point where we start hearing the lub-dub is noted as systolic pressure. Here I started hearing it at 120. Continue to loosen the lock and you will be continuously hearing the heartbeat sound, and at a certain point you will stop hearing it, and that point is recorded as diastolic pressure. Here at this instance it is 70 mm of Hg. So finally our recording is 120 by 70 mm of Hg. Let's have a close. Let's now see the procedure using aneroid. All the steps are same even with aneroid. The two main differences are, first one, it has a hook-like structure. We can actually put the measuring part on the cuff. Secondly, the pointer you see here is used to indicate where we start hearing heartbeat sound and where we stop hearing it. Coming to the dynamometer, it is rather easy. We have to wrap this cuff around the patient's hand and press the bulb here and slowly loosen the lock beside it, and the BP value will be given here in the digital screen.